कोई भी पेशेंट अगर किसी भी फिजिकल डिसेबिलिटी से सफ़र कर रहा है तो उस पेशेंट का प्रॉपर असेसमेंट, उस पेशेंट के ट्रीटमेंट के लिए रिहैबिलिटेशन प्रोटोकॉल की प्लानिंग करना और फिर उस रिहैबिलिटेशन प्रोटोकॉल्स का उस पेशेंट पे इम्प्लीमेंटेशन करना ही फिजियोथेरेपी कहलाता है। बेसिकली इस फिजियोथेरेपी ट्रीटमेंट की जो मेनली विधाएं हैं, आपका थेरेपेटिक एक्सरसाइज है, एक्सरसाइज थेरेपी है, सर्टेन फिजिकल मॉडलिटीज आप यूज कर सकते हैं, सर्टेन डिवाइसेस को आप यूज कर सकते हैं, मैनुअल थेरेपी भी आते हैं, उसमें पेशेंट के लिए एजुकेशन एज वेल एज द पेशेंट का ट्रेनिंग भी इंक्लूड होता है। WHO defines physiotherapy that physiotherapy means the physiotherapeutic system of medicine where physical agents like heat, cold, light, water, electricity and exercises including mobilization as well as the manipulation are used to treat modalities which have diagnostic, prognostic, preventive, as well as rehabilitative dimensions in the treating of disease, disorder, or disability. The concern is the same. If any patient is suffering from the physical disability, the process of assessment, it means the making the proper diagnosis, because we all know before making the proper diagnosis you are not able to treat any kind of patient. So now we'll discuss about the history of physiotherapy, how physiotherapy got revoluted. So before 460 BC, there will be Hippocrates and Galen. It is believed that he was the first practitioner of physiotherapy in the form of massage. He introduced the form of massage, hydrotherapy as well as the manual therapy. Basically, these were two physicians who introduced the first form of massage, hydrotherapy and the manual therapy. Next, in the 18th century, when there was the development of orthopedics, there were certain equipments, gym equipments, that equipments are considered as the gymnastic on, and these equipments was basically used for the treatment of certain orthopedic conditions such as gout, and basically the main purpose of using these equipments are the strengthening of the muscle power. So treatment of these musculoskeletal conditions with the use of these equipments includes the musculoskeletal strengthening. Next, in the 1813, there is Pen Henrik Ling from the Royal Central Institute of Gymnastics, RCIG, which works for the manipulation and the exercise. He was also known as father of gymnastics. He was also considered as the pioneer of physical education. Later on, the first school of physiotherapy was introduced in the University of Otago, New Zealand. When there was the outbreak of polio, the concept of hydrotherapy was established to treating the post-polio residual paralysis, PPRP, and at that time, basically the pool therapy, hydrotherapy, the concept of hydrotherapy came. After the First World War, the School of Physical Therapy was established in the Walter Reed Army Hospital, Washington, and when there was the polio outbreak in the 1958, it was very common that the occurrence of physiotherapists was very much common in the IPD as well as the OPD patient. The patient who was suffering from the bulbar palsy, bulbospinal type of paralysis, the involvement of the respiratory muscles. In that case, physiotherapy play a crucial role, especially the chest physiotherapy. So when there will be the outbreak of polio, the physiotherapy, the concept of physiotherapy in the IPD cases, in the care of the patient who is suffering from the bulbospinal palsy, the involvement of the respiratory muscles, the chest physiotherapy concept has been. Next, in the India, 1953, in the King Edward Hospital, the first physiotherapy was developed. Second school was developed in the CMC Vellore, and the third school was developed in the Government General Hospital, Chennai. So this is the development of physiotherapy in the India, revolution of physiotherapy in the India. Now, what is the role of physiotherapy in the intensive care unit? What is the role of physiotherapy in the critical care unit? Before knowing the role of physiotherapy in the critical care unit, you must know about the what is the intensive care unit. So, what is ICU? ICU, it is also known as ITU, Intensive Therapy Unit, Intensive Treatment Unit, Critical Care Unit, and very simple, we all know that ICU is the most advanced, most developed ward of an hospital who provide the intensive care medicine. A patient who is suffering from the life-threatening disorders, एक ऐसा पेशेंट जो कि जिंदगी और मौत के बीच जूझ रहा होता है, उस पेशेंट के ट्रीटमेंट के लिए किसी भी हॉस्पिटल का सबसे वेल इक्विप्ड, वेल डेवलप्ड, वेल डिजाइन वार्ड जो कि इंटेंसिव केयर थेरेपी को प्रोवाइड करता है, दैट इज कंसीडर्ड एज अ ICU. Now, how the concept of ICU Now, what is the concept of ICU? What is the history of ICU? How the concept of ICU came? Basically, in the 1954, there was a Crimean War, a war between the British and Russia. So British और रसिया के बीच में एक war हुआ था. वहाँ पे the soldiers, there are two kinds of soldiers. War के दौरान दो तरह के soldiers थे. A soldiers who is hemodynamically stable and the soldiers who are critically ill. So the treatment of both the patients is done in the different wards. Simple form में आप ये समझिए कि पहले जो ट्रीटमेंट होते थे सारे पेशेंट्स को एक जगह पे इकट्ठा करते थे. अब अगर वॉर के दौरान the patients who is hemodynamically stable and the patient who is critically ill, the treatment simple protocol followed that by the Fluorescence rectangle. The treatment of the hemodynamically stable patient is done in a different ward, and the patient who is critically ill, the treatment of those patients is done into the different ward.